Welcome to MetroSTL.com. I'm Charles Jaco. We're pleased to be joined today by Dr. Denise Hooks-Anderson. She is Assistant Dean for Diversity, Equity, and Inclusion over at the St. Louis University Medical School. Doctor, we appreciate your time. I wanted to open with the thought that getting access to the vaccine in metropolitan St. Louis for just about anybody has turned into a version of the Hunger Games, but it's incrementally worse in Black and Latino communities. As a medical professional, why do you think that is?
My honest opinion is that this entire process has been very unorganized from the beginning. Basically, states were just sort of left on their own to come up with their own plan for distribution. And another problem is that they don't know when they're going to get an allotment of vaccine. And in addition, so the people who do receive the vaccines, the different sites, also don't know how many they're going to get at any time. So it's really hard to kind of coordinate. And if you add in, our underdeveloped communities and our minority communities, the situation is even worse. And it's similar to when we first started this pandemic and the places where you could get testing. So if you go back to the beginning of this pandemic, the initial testing sites were not in the hardest hit areas of the areas where you knew people were living in multi-generation homes, where you knew that there were higher rates of diabetes and hypertension. So these type of disparities have just continued throughout the entire pandemic.
How much of this do you think was just incompetence, unpreparedness, making it up as they went? And how much of it is purposeful? Because I've been struck by the fact that these overwhelmingly white rural counties where you have more cows than people have an excess of vaccine, sometimes going with dozens of shots being unused. And in urban areas, especially parts of those urban areas that are communities of color, it's almost impossible to come by. On one hand, one could say, well, they were making this up as they went along. On the other hand, one could say that this was a politicized process and they were playing to their base and this was done with malice aforethought. Do you have any thoughts on that?
So I think your assessments are right on. I like to call it necromedicine. If you keep doing the same types of detrimental activities to underserved communities, it does look purposeful. And it looks as if it's an intentional act. So I think it's a combination. I mean, unfortunately, we have made this pandemic a political issue. Never in my entire academic and medical career have I thought of science as political, but it has been made to be. And yes, again, as I mentioned before, we can start with the testing, which was not in the areas in minority communities. They were in rich white areas initially, particularly here in St. Louis. And then when it comes to receiving the vaccine, and there's stories of having a site in North County, which has a large percentage of African Americans, having a site for the COVID vaccine. And if you look at the addresses of the people coming out to receive the vaccine, they're from wealthy white areas. So, or having extra vaccine in these smaller rural communities that don't even need that much compared to the need that we have here in the city. So I agree with you. At times, it seems and appears purposeful. Again, what I call necromedicine, this purposeful neglect of poor and underrepresented people.
Where do we go from here then, given that things are as they are, given that a extremely conservative Republican supermajority in the state controls the access to the vaccines and the way this has been rolled out? They say more mass vaccination sites are coming to the city. Should Governor Parson appoint you as a czar of vaccinations tomorrow, what would be the very first thing you would do to remedy these inequities or try to?
Well, again, I would look at the data. We know the parts of our communities that were hit the hardest, and it should have been a no-brainer that those communities should have had the bulk of the vaccine. And I feel like that as a provider and other healthcare workers, as we bind together, we have to continue to try to educate our leadership to understand that you give the resources to the people that need it the most. And we have to constantly remind them of the science and what happened in the past when we didn't do that in the beginning. So I would make sure those communities have what they need.
Do you think the mass vaccination sites are an answer, or do you believe that from the beginning we should have plugged into a network that was already there, that is pharmacies, whether it's CVS or Walgreens or local clinics, where they're used to giving flu shots every year, and just say, here, let's do them? Which do you think would have been most effective?
Well, I would even go back further than that because again, I go back to, unfortunately, this entire process has been very unorganized. We were behind the eight ball with the infection itself and how we managed it. And then when it came down to the rollout, unfortunately, leaving every state to come up with its own plan with a massive nationwide program is just problematic. So it should have been a more well organized process from the top, given states particular direction. And yes, we should have been relying on the people that handle vaccines in great numbers more. Yes, utilizing our pharmacies, utilizing our public health institutions. Again, just allowing people to just kind of come up with their own plan and what I call willy nilly providing guidance has just been detrimental.
Given that, and given the Governor Parson has announced that there are going to be more, quote, mass vaccination sites in the St. Louis metro area, what does one do to try to ensure there's at least something approaching equity in this? As you've noted, for example, at Harris State University, where vaccines were being given, a large numbers of those vaccines were given to white folks who had access to high-speed internet, saw the sign up, bing, 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 went on, signed up, went there. It wasn't necessarily, it may have been racist in the way it turned out. I don't think it was intended to be racist at the beginning. It was a matter of privilege. If you've got high-speed internet and you're looking
Mhm.
for this stuff all the time, you'll find it. And if you're holding down a couple of jobs to make ends meet
Right.
and you've got kludgy internet, you're not going to be able to find it. How do we overcome that right now? Are these mass vaccination sites enough, or does the state government need to take a couple of steps further in Black and Latino communities to make sure that people who need them and want them can get these vaccines?
Well, we need alternate routes to get the information to the people because, like you just mentioned, our elderly don't have internet access. So, how are they finding out about the vaccine sites? Or people that if you do have internet access, it barely works. So it needs to be in all forms of the media. We need our public health officials. This is almost at this point going to neighborhood by neighborhood to make sure people have the information and utilizing our big health systems to also spread the word within their networks to make sure that their patients are getting vaccinated. So again, just relying on um, putting the information on a website and telling people to go to that website is inadequate, as you mentioned.
So, what does one do? I mean, utilizing the muscle of organizations like the SLU Medical School, the WashU Medical School, other public health, uh, outward-looking organizations. Is it a matter of literally almost going door to door with flyers saying, day after tomorrow, there's going to be a vaccination site at thus and such address? I mean, what does one do logistically as a medical professional to reach out effectively to these communities in time so people can line up and actually get these shots?
Well, I've been telling my patients that do have internet access to make sure you sign up at every site possible, the state site, the county health department, the city health department. Sign up for the institutional sites, your SSMs, your BJCs, your Mercies, your big groups. In addition, we should be putting this on the news outlets, radio, television, and print, because our elderly population still like to have print, utilizing our minority driven media outlets, the radio stations, the newspapers. We need to be hitting all forms of communication to make sure no one is left behind. And again, I liken this to, we have to always remember this. If white America catches a cold, Black America and Latino America will have pneumonia. So again, if there's a situation going on that is something horrific going on in our country, we have to look at our vulnerable populations to make sure they have what they need.
Given the way things are going now, do you have any hope that that's actually going to happen? Or do you think in your darkest moments that there is a good portion of these communities that is going to go unvaccinated because they're just not going to be aware of where to get the shots and how they're available?
So I'd like to answer that. I always want to have hope. Is the track record good? No, but I still want to have hope. And I just think that all of us in the public health sector, in medical communities, like what you're doing, media outlets, we have to just keep banging on the doors, ringing the bell, setting the alarm so that people are made aware. And unfortunately, we just have to do the best we can. This race is, we started behind the eight ball in this race. And so it's constantly been a catch up to try to get people where they need to be healthy and secure and safe. So I have hope. But yes, do I think some people will be left behind? Yes. I mean, just today, I mean, some of the patients I've talked to, I mean, they're still asking the question, how do I get the vaccine? What do I do? I mean, there's still people out there that don't even know the first step of how to go about getting the vaccine.
Doctor, I'd like to end with something I found very troubling. There was a survey that just came out, I believe, by Harvard Medical School and others that indicated up to 25% of all the adults in Missouri were going to refuse to get this vaccine. I know in some media outlets there's been a lot made of this. I am suspicious of that, but I wanted you to tell me, in minority communities, is there a level of hesitancy, or is it simply a matter of lack of access?
So it's a combination of both. Minority communities, rightfully so, distrust the medical environment. We can name several historical moments that people have that they remember, that they quote as reasons why they won't get the vaccine. Henrietta Lacks, mistreatment of Native Americans, the Tuskegee experiment. We can go on and on. You can even go back to slavery and the experimentation on slave women. And when Black communities, particularly, talk about this, they're like, why would I trust anything coming from the federal government? They've never had my best interests at heart. And we have to honor their feelings, because those feelings can't be dismissed, because it's truthful that there have been things in our past that we have not shown the best light, and we have not treated all of our citizens equally. So that rebuilding trust between the Black community and the medical community is something that we should constantly be working on. And we need to make sure we are explaining the science of the vaccines very well, explaining the people who've been involved in the vaccines. I like to share with my communities and people that I educate that Dr. Fauci is someone who is someone you can trust, who's been doing vaccine work for years, decades, even. There's even an African American scientist from the NIH who was involved in the development of the COVID-19 vaccine. And again, I think if we had had these kind of conversations in the beginning, explaining that the technology used in the vaccines is not new, that it's research that they've been doing, and that there were people of color involved, not only in the research itself, but as clinical participants. If we had not named it Operation Warp Speed, that does not give people confidence when you name the process such. So again, we've had missteps in the language, missteps in the branding that I think also caused people to have some hesitancy.
Dr. Denise Hooks-Anderson from the St. Louis University Medical School. Doc, it has been a real pleasure and an honor. Thank you very much for joining us.
Thank you for having me.